What surprised me most was how quickly AI-driven algorithms have started to outperform traditional statistical models in identifying early signs of diseases like diabetic retinopathy. Here's the takeaway. The pace of change is forcing both clinicians and researchers to rethink their workflows.
That's backed up by recent studies. One from 2023 showed that AI models analyzing retinal scans achieve diagnostic accuracy rates above 90%, which is a significant jump compared to manual review. But the real shift is in speed. What used to take days can now be done in minutes.
But if these systems are so effective, why do we still see hesitation in clinical adoption? Is it just about trust, or are there deeper issues with how these algorithms generalize across different patient populations?
It's both. There's excitement about AI's potential, but real-world implementation often hits roadblocks like limited data diversity or concerns about algorithmic bias. For example, an AI tool trained mostly on data from one region might miss key patterns in another.
And on the research side, AI is accelerating drug discovery. Companies are using machine learning to predict molecular interactions, which has reportedly cut early-stage screening times by up to 70%. That's a leap forward, but only if the predictions hold up in clinical trials.
I partly agree, but there's also a risk of overhyping what AI can deliver right now. Predictive analytics in epidemiology, for instance, still struggle with rare diseases where data is sparse. Shouldn't we be more cautious about promising breakthroughs?
Absolutely, and that's why transparency in model development and validation is critical. Still, the shift toward personalized medicine, where AI tailors treatment plans to individual genetic profiles, could redefine patient care if we address these limitations head-on. Only after 2 iterations we realized that our AI model was consistently underperforming with data from rural clinics compared to urban hospitals. That gap really highlights how training datasets can reinforce existing disparities.
That's a classic example of dataset bias. In a 2021 review, over 60% of published healthcare AI models were trained primarily on data from North America and Europe. When those models are applied elsewhere, accuracy can drop by as much as 20%.
But if we know these limitations, why aren't institutions mandating more diverse datasets before deployment? Is it just a resource issue, or is there something else holding back broader adoption?
Part of the problem is regulatory uncertainty. Current frameworks often lag behind the pace of AI innovation, so researchers hesitate to share sensitive patient data across borders even when anonymized.
And let's not forget transparency. Many machine learning models, especially deep learning, are black boxes. In one case, an AI tool for sepsis prediction was adopted in several hospitals, but clinicians couldn't interpret its risk scores, leading to inconsistent patient care.
If clinicians can't trust or understand the recommendations, isn't there a risk that over-reliance on AI could actually erode patient trust or even de-skill medical staff over time?
Here's the takeaway. Unless we address data diversity, transparency, and regulatory clarity, AI's promise in healthcare will remain just that, a promise, not a reality for all patients. Only after 2 iterations, we realized that the real breakthrough in early cancer detection wasn't just about the algorithm, it was about getting access to high-quality, annotated imaging data. That's what allowed the machine learning models to actually outperform human radiologists in some trials.
That's a crucial point. For example, in a 2020 study, a deep learning system trained on over 29,000 mammograms achieved a lower false positive rate than 6 expert radiologists. But those results depended heavily on the diversity and quality of the training data.
But can we really call these isolated successes a sign of a broader trend? If most hospitals don't have access to such rich datasets, isn't there a risk that these models only work in controlled environments?
Here's the takeaway. The most scalable AI applications in healthcare have come from interdisciplinary teams, clinicians, data scientists, and ethicists working together. That's how natural language processing started making sense of unstructured clinical notes, not just in research labs, but in some hospital systems.
And in genomics, AI-driven variant interpretation has accelerated rare disease diagnosis. For instance, deep variant from Google has been benchmarked to match or exceed the accuracy of traditional methods, but it required rigorous validation and regulatory oversight before deployment.
If ethical oversight is so central, What happens when AI systems make recommendations that clinicians can't easily interpret? Doesn't that slow down adoption, even if the results are promising?
That's where transparency and explainability come in. The projects that have scaled best are the ones that invested early in making their models interpretable, not just accurate. Otherwise, even the most impressive technical results struggle to gain trust. Only after 2 iterations we realized that our AI model was consistently underperforming for certain patient populations. That forced us to confront the real risk of algorithmic bias in healthcare research.
That's a classic example. Recent studies show that some diagnostic algorithms have up to 30% lower accuracy for minority groups compared to the general population. The data used to train these models often reflects existing disparities.
But if we know the data is skewed, why aren't there stricter requirements for transparency? Shouldn't patients have more control over how their health data is used in these AI systems?
Here's the takeaway. Building transparency isn't just about publishing code or data sets. It's about creating mechanisms for informed consent and ongoing oversight, so patients understand and can influence how their data shapes research outcomes.
There's also the issue of equitable access. For instance, a 2023 survey found that rural clinics are 40% less likely to implement AI-driven diagnostic tools, which could widen the healthcare gap if we're not careful.
Is there a point where the risks outweigh the benefits? Are there scenarios where using AI in healthcare research should actually be off limits, especially if it could reinforce existing inequalities?
That's where responsible innovation frameworks come in. Some organizations are piloting ethics review boards specifically for AI projects, aiming to catch these issues before deployment. It's not perfect, but it's a start.
Ownership of healthcare data is still a gray area. Legally, it often belongs to the institution, but ethically, many argue it should remain with the patient. Without clear guidelines, trust in AI-driven research will remain fragile.
Only after 2 iterations, we realized that AI's biggest impact might not be in replacing clinicians, but in transforming how research questions are even formulated. Here's the takeaway. The future could be about AI surfacing patterns we never thought to look for.
That's supported by recent data last year. Over 30% of new clinical trial hypotheses in oncology were generated with AI assistance. But the adoption rate is still lagging in smaller research centers, mostly due to lack of infrastructure and training.
If that's the case, what happens to the traditional skill set of a healthcare researcher? Should we expect coding and data science to become as fundamental as clinical knowledge?
Absolutely, but it's not just technical skills. Researchers will need to become translators, bridging the gap between what AI can do and what clinicians actually need. That means a new emphasis on interdisciplinary communication.
And there's the question of public trust. Surveys show that only 42% of patients are comfortable with AI making diagnostic decisions. Without transparent validation and clear policy, even the most advanced tools might struggle to gain acceptance.
But isn't there a risk that, if we move too fast, we'll overlook unintended consequences? For example, could reliance on AI reinforce existing biases in healthcare data?
That's a real concern. The path forward isn't just about technological breakthroughs, it's about building robust safeguards, updating education, and ensuring that policy keeps pace. If we get that balance right, AI could truly revolutionize human health. Thanks for joining us as we explored what's next for AI in healthcare research.